Welcome, and enjoy today's presentation by Brandon Thomas. Have you ever felt short of breath, but never understood why? Well, let's do a little research. Join me on an adventure to easily understanding asthma.
What you need to know. Globally, 300 million people suffer from asthma. 250,000 of them die yearly. In this next section, let's take a look at the anatomy that is affected. Here we have the lungs. The right lung, the left lung, the right bronchi, the left bronchi. Below is the diaphragm, above is the trachea, or the air passageway. Let's zoom in a little. Here we have the bronchi. The inner layer of the bronchi is the mucosal layer, or mucous membrane. Surrounding that are the smooth muscles. This will be important later on. Under normal conditions, you should have open airways, no struggles breathing, and mucus should be collecting particles that would generally cause inflammation, like pollen or dust. Symptoms of asthma. Symptoms of asthma include chest tightness, dyspnea, which refers to difficulty breathing, wheezing, high-pitched whistling due to narrowing of the airways, and coughing. During an asthma attack, the bronchial airway will tighten or narrow. This is the result of the smooth muscle lining contracting. Additionally, the mucosal layer will become inflamed, causing the air passageway to narrow even further. During this time, mucus will also be secreted rapidly. In doing so, sometimes the air passageway can become blocked or clogged. Asthma attacks can be set off by certain triggers. These triggers include pollen, working out, smoking, cold weather, the flu, and dust. Let's review what happens during an asthma attack. Airways will become constricted due to bronchospasms, which are the smooth muscle linings on the airway constricting. The chest will feel tightened. Mucus will begin clogging the airway. This is due to excess secretion during those inflamed times. Hyperinflation will occur. Hyperinflation is when too much air has begun to be trapped within the lungs due to the fact that these now narrow passageways can no longer become dilated, releasing the air. In worst case scenarios, this can eventually lead to death due to organs not receiving sufficient oxygen. How do we treat asthma? Despite how unpredictable the outside world may seem, reducing exposures to triggers is possible. An example would be removing carpets or rugs from one home. Also, spending limited time in harsh environments that would be difficult for respiratory systems. Second, and most successful treatment option, are inhalers. It's transportable and delivers two types of medication. These two types of medications are reliever medication, which treats symptoms immediately, and preventative medication for long-term treatment. Reliever medications focus on beta agonists, which help dilate airways immediately during asthma attacks. Corticosteroids help reduce the sensitivity of the air passageway, limiting their responses to environmental triggers, which would induce inflammation, and chronic inflammation can result in scarring, which ultimately will narrow the passageway permanently. As seen by the diagram, once it has become irreversible, scarring will have permanently narrowed the passageway, making it much harder to breathe. It's important to understand that not everyone's asthma is the same, and as a result, everyone should have their own unique medicine plan. These medicine plans should include knowing how and when to use the medicine, and also they should be confident that they know the medicine is going to work for them. Using an inhaler is not as easy as it looks. It can take quite a bit of practice. It's important that the medicine reaches the lungs and not just stays up in the mouth. Therefore, these medicine action plans are very important to treating asthma, especially in cases of emergency. Risk factors and causes of asthma. Despite the advances we had made in both treatment and diagnosis of asthma, the exact cause is still unknown. It is believed that genetic and environmental factors both play a role in the onset of asthma. In association with genetics, certain genes have been identified to put you at a higher risk for obtaining asthma. Additionally, if you have a family history, you seem to be more at risk. For environmental factors, the hygiene hypothesis suggests that a reduced early exposure to bacteria and viruses puts you more at risk for the onset of asthma. Therefore, we are able to associate genetic factors with early onset of asthma as environmental factors with later onset of asthma. Furthermore, new research has indicated that there is a possible linkage between poverty and asthma. The research indicates that this linkage is brought on by the fact that low socioeconomic status brings about more exposure to pollutants and environmental irritants. Additionally, those of lower socioeconomic status sometimes fail to attain proper health care, which can ultimately lead to attaining asthma. Now that we've covered the basics of asthma, let's review what we've learned on today's research adventure. Recently, we learned that asthma can be brought on by both genetic and environmental factors. These environmental factors can range from anything including smoking, secondhand smoke, pollen, flu, cold weather, dust, and even stress. It's really no surprise that 300 million people suffer from asthma when we run into these environmental triggers daily. Next, we also learned about the anatomical events that occur during asthma. We know it takes place in the lungs, more specifically the lung airways. We zoomed in even further to take a look at these airways. The inner lining is called the mucosa, or the mucous membrane. Surrounding that are smooth muscles. These smooth muscles can contract, causing the airway to narrow. Additionally, the mucosal membrane can also be inflamed, causing further narrowing. We also know that during times of narrowing, when the inflamed mucosal membrane happens, mucus is secreted, causing that to even further obstruct the airways. When this happens, we're having an asthma attack. But we can be prepared for this with the action plans that we mentioned earlier. If we follow the action plan, we'll know to use our inhaler, which will dilate our airways, preventing the asthma attack from continuing. That way, we can go about having happy and healthy airways for the rest of the day. I hope you all have enjoyed this presentation and enjoyed learning about asthma as much as I have. Thank you, and see you all again soon.